Hello, my name is Jeremy, and welcome to The Real Truth. Like, comment, and subscribe, and let's go ahead and get started. Why not nursing? It's literally the most versatile degree in healthcare. If you're thinking of it from a bachelor's degree perspective, or maybe even from a graduate degree level as well. I originally started off as a pre-med. I was going to go the traditional route, go Bio 1, Bio 2, Chem 1, Chem 2, Physics 1, Physics 2, Cal 1. Oh, I already said Cal 1. But you get the gist. Organic 1, Organic 2, and Biochemistry. But in the process of it, I did realize that these classes are time-consuming and ridiculously hard, and you really need to actually get a high enough grade in it. So during that time span, I noticed that the only bachelor's degrees that you can basically get with these is, for the most part, biochemistry or physics center-based. That usually went into like an area of healthcare that I just didn't want to go into, or sort of like a research aspect that I didn't want to go to. So, doing a little bit further research, I decided, why not just do nursing? Half of the prereqs pretty much goes with it anyway. Kills two birds with one stone, get a bachelor's degree, and you can apply for med school anyway. So, from that aspect of it, from a financial aspect, it makes sense because, like, from a biology or chemistry perspective, you can, from a bachelor's degree level, you can only become a high school biology teacher, high school chemistry teacher, and that's roughly around 40, 50K a year. There's nothing wrong with that, but I would like to have more options in case, life happens and you just basically said, this shit fucking sucks. I'm good. I don't want to fucking do it. You have the freedom with it. So I chose nursing, and then I'm going to continue on with trying to get into med school. And even if I have to do a post-bac, I can just work a certain amount of overtime and just pay for it from there. So it just gives you a lot of freedom. So that was one aspect that got me really into knocking out nursing. And I graduate in April. And then after that, I'll take a semester off, and then I gotta knock out pretty much like organic chemistry and physics, and then I can just apply. But let's just say, even if you go the dream route, I guess, is if you're in a branch of service like the Army, Navy, or Air Force, where they have a health professional scholarship program, which would pretty much pay for med school and give you a monthly stipend to go in, so you're not just starving medical student. That's amazing. And the only downfall of that is, like, which not really a downfall, if they're paying for your med school, is for each year that they pay for your school, you have to serve. And it's like, okay, whatever. But what if you get into it and you're like, man, this shit really sucks, I really don't want to do it. But the moment you take the scholarship, you're kind of obligated to service time. So you don't really have to deal with that with nursing. Like, I know there's like a lot of expensive schools out there, but there's different resources to pay for it. Like, there's the HRSA website to basically do student loan repayment. Hospitals have repayment programs. There's companies that's willing to pay for it. There's even bonuses within nursing that you can put that towards your tuition or put that towards whatever and stuff. There's bonuses with nursing that can go from sign-on bonuses that can go from 10 to 20 to, in some cases, like 20K. So you can use that towards your education. You can use that to be debt free. You can use that, so you don't necessarily have to go that route. It's just, it brings a certain level of freedom. So that's why I chose it. Like, and there's nothing wrong with it. And even if you're thinking from a patient care perspective, the person that's with the patient the most is the nurse. The doctor's in for 10-15 minutes, respiratory therapists in for 10-15 minutes, x-ray technicians, get them in, get them out. Even in a stress lab, it's like 15-20 minutes. They get them on a treadmill, they'll do a chemical test, give them an antidote, good out the door. Just, you can't, like, it gives you the general knowledge, gives you like a heads up of, hey, this is what you're signing up for, and if you want to back out, you already have your degree with it. There's different areas that you can work in. There's informatics, there's telestat, and then where you don't even have to be near the patient, but you're just at home, you're comfortable. You probably have like your dress attire right there. You have your coffee and stuff, and be in your pajamas at the bottom and stuff. I don't know. So yeah, like I just like that versatility, because like you may have a change of heart. You may basically be like, hey, yeah, you're working as a nurse and you've been there for about like 2 or 3 years. You're making like 75, 80K a year, and you're like, okay, you know, it's not doctor, but if I'm actually good, I don't really need it. I just want to live my life. You have that option. Now, if you're basically in med school and you're in like your 6th year and you accumulated about like probably like the average yearly, the average debt coming out of medical school is like 200K. So if that's the case, that's like 50K a year, and I think I'm lowballing it. Yeah, like if you're already done 2 years, you're already 100K in debt. You're already in a mortgage. So, and the only way to pay it back at this point is to basically get through med school, pray that you get into residency, and then the residency is going to pay you like 50-60K a year, which is going to be less than what you're making as a nurse. So that's a long time to basically accumulate debt, accumulate interest, and go from there. So, but if you have your nursing license and you decide to go through it, you can basically just work 3 days out of a week or work 2 days out of a week, and you can. My personal opinion, it would probably be best to do psych or home health during that time span. So like, and do it overnight. So the patient has a time to sleep. You check on the patient. You do your monthly rounds. You set up an alarm, and you go from there. It's a lot of versatility towards almost anything. It's kind of like if you're starting from the bottom of any career and you needed to find a job to give you a good amount of time to study. And you can even use this for trying to nursing school. You can do like security, tell them, hey, I got school. They put you at a spot where you can basically study, and there's nothing to do but really study. It got me through medic school, and I went to the paramedic security aspect of it, and with the amount of time outside of 911 calls, I have to basically study. So like, you can basically go from there, and basically from the nursing aspect of it, you get home health. You have X amount of time when they're asleep. You study. You can't be asleep anyway, because you might as well study and then check up on your patient. But you'll have plenty of time to actually really do that, and you can advance it further and further. You'll have more time to study than a lot of your peers. So all the way around, nursing, in my honest opinion, you can't really beat that. There's the ER route, but if you're going more towards there's the ER, there's the ICU, and there's the bedside route with that. But my honest opinion, if you get into nursing and then you go into pre-med route, I would suggest going through your year, getting your nursing license. Then after you have your nursing license, through the year you're finishing up your prereqs, do your bedside. And then after you get that year of experience of your bedside, do home health overnight. And do what you need to do. The patient's asleep. Set up a timer to check on the patient every single time, per your regulations. And then your downtime, you study. It makes it a lot easier. I think it makes it more. It makes it a lot more comfortable for you. It makes it so you can pay off your debt if worst case scenario you're not able to find a scholarship. And it just makes it a lot. It makes it a lot more doable. There's like a lot of the college aspect of it doesn't really tell you the options for schooling. Bare bones. If you have nothing right there to even get into nursing school, you can work security. I think it's like $150 to $200 to get your security license without a weapon. You can work overnight, and you can pretty much be at a spot where you can basically study. and then from there you can basically study, get your nursing license, and then you'll have to balance between whatever bedside you decide to do for that year to get that experience, and then do home care, and then you can do the same thing to get the advanced degree or med school, whatever stuff. So it's a lot of versatility. There's different areas of growth. The self-growth is pretty much through the roof. You can't go wrong with it. And that's all I got to say about it. Like, comment, and subscribe, and more videos on the way.